Once a patient is in the hospital, there are many different ways surgeons can treat the stroke. Let's first talk about ischemic stroke treatment. Surgeons essentially use a type of device or treatment called as clot busters, because in an ischemic stroke, what happens is, as we discussed, there's a clot blocking an artery in the brain. So angioplasty is the fancy term for this, and it's when you mechanically widen an obstructed artery. So there's many different types of devices that surgeons use on treating patients. One is called a balloon catheter. So here we have an artery drawn in red, and then in yellow we have the obstruction, which can be fat or plaque or some sort of clot. So the blue is the balloon catheter device that the surgeon will insert, and this device can inflate itself to a big amount using high water pressure. So it inflates inside the artery and it pushes back on the clot, helps clear the way, get rid of all the obstruction, and then you can deflate the device again and pull it out of the body. And as you can see, it helps clear the blood flow through the artery. So another tool or another method they use is called thrombectomy. And here we have another artery, and we have the clot drawn in red. And what you do is you have this device that goes in and it coils up, and it can release different substances that can help dissolve and remove the clot. And then you can pull out the device and bring with it the remains of the clot to help clear the way. So another category of treatment is called tissue plasminogen activators, or TPA for short. And these are just proteins that can break down the clot. And they're usually given to a patient using an IV. So you just inject it into them, and then the proteins do their job. And the key here is you must give this treatment within 3 hours of a patient's stroke onset. So that's why we kept talking about how we have to act fast when you see a stroke. So now let's talk about treating hemorrhagic stroke. So here, the goal is essentially to use surgery to treat a ruptured artery and to stop the bleeding of any arteries. And it's even better if you can tackle the problem early and prevent the artery from bursting or bleeding in the first place. So here we have an aneurysm, as we talked about earlier. We have blood gushing in that little round bulge you see, and the surgeon will insert a coil, and this coil will go up into the aneurysm and stop excess blood flow from going there and harden the material there so that that bulge doesn't break. And 2/3 of stroke cause permanent damage. So that's why it's vital to act fast. So rather than getting involved in the whole ordeal of surgeries and medicines, why not just prevent the stroke altogether? They're quite preventable if you just lead a healthy life. This involves having a healthy diet and exercising regularly. There are some key risk factors to look out for in stroke, and these are high blood pressure, diabetes, and also irregular heart rhythm disorders. So some of the causes for these risk factors are fatty foods that are high in cholesterol and saturated fat. So the key is to watch what you eat, keep a careful tab, and make sure to limit these foods. And they are all over the place, and we eat them quite often. Pizza and other cheesy foods are high in fat and cholesterol content, so it's best to reduce this and make sure you exercise to make up for it. And on the other hand, eating things like fruits, bananas, oranges, apples, and vegetables, they're very healthy, and you should make sure to supplement your diet with those kind of foods. Furthermore, smoking is really bad for stroke. It actually doubles your chance of getting a stroke. So no matter what you've heard, what your friends tell you, definitely avoid smoking at all costs, as it can cause many diseases. Finally, stress is actually a big factor for stroke. Many people don't know this, but you should try to lower your stress levels by doing yoga, meditation, or deep breathing. Many of these simple activities can help with that. So finally, 80% of strokes are preventable. So why not take these simple steps in your life, these simple choices in diet and exercise, and prevent it? You can do it, and good luck.